considering the pulp and periapical diseases, you have to keep these 6 things in mind. That is pain, tender percussion, vestibular tenderness, swelling, sinus, and radiographic examination. We don't consider pulp vitality because it takes time. So let's start. First is reversible pulpitis. In this, if the pain is mild to moderate and the tooth is non-tender on percussion and there is no vestibular tenderness, on radiographic examination it says it's close to pulp, then it is reversible pulpitis. If the pain is occasional or absent and on radiographic examination it involves pulp, then it is chronic irreversible pulpitis. If the pain is severe, then it is acute irreversible pulpitis. In acute apical periodontitis, the pain is severe, continuous, and throbbing, and here starts the tender on percussion, and there is no vestibular tenderness, and there is periapical changes like periodontal ligament widening. In case of chronic apical periodontitis, it takes more than 1 week, and the pain may be absent or occasional. It might be tender on percussion or non-tender on percussion, but the radiographic changes are the important thing, where there is thickening of lamina dura. Well, lamina dura is a thin bone that covers the socket, and thickening of it means periodontal infection has started, and it appears radiopaque. In case of acute periapical abscess, there is severe throbbing pain, and there is tender on percussion along with vestibular tenderness. There is additional symptom like fever or chills, but it is not in all cases. And there is widening of periodontal ligament space and breakdown of lamina dura. So this acute periapical abscess might go into chronic periapical abscess, or it might skip that and directly become acute dentoalveolar abscess. Well, in this case, there is severe throbbing pain and there is tender on percussion. Along with vestibular tenderness, there is vestibular obliteration and erythema. Obliteration means like a swelling around the vestibular area, and there is extraoral swelling. The radiographic feature is almost similar. It is widening of periodontal ligament space and breakdown of lamina dura. In case of chronic periapical abscess, it happens like more than 1 week, and there is no pain or occasional pain. It might be tender on percussion or non-tender on percussion. There is vestibular obliteration. Sinus formation may or may not be present. It is not a significant finding. The main thing is vestibular obliteration and the time duration. And there might be history of pus discharge. In the radiographic features, there is loss of periodontal space, not widening, and there is breakdown of lamina dura, and additionally there is diffuse periapical radiolucency. Now coming to chronic dentoalveolar abscess, there is mild or occasional pain, and there might be tender on percussion or non-tender on percussion, and there is vestibular tenderness with obliteration. There might be regional lymphadenitis present. Sinus opening may or may not be present, and history of pus discharge may be present. So the main thing to keep in mind is the pain, the duration, vestibular tenderness with obliteration, and the regional lymphadenitis. In the radiographic feature of chronic dentoalveolar abscess, there is loss of periodontal space, breakdown of lamina dura, and diffuse periapical radiolucency. Now coming to chronic hyperplastic pulpitis or pulp polyp, it is like clearly visible. The pulp will be bulbous and clearly visible, and it bleeds on probing. On radiographic feature, it is deep dental caries with pulp involvement. So that is all about pulp diseases. Now let's go to the periapical diseases, which consists of periapical granuloma and periapical cyst. In periapical granuloma, the pain may be absent or it might be present on biting hard food, and it might be tender on percussion or non-tender on percussion. So the radiographic feature says that there is loss of periodontal space, and there is breakdown of lamina dura, and there is well-defined periapical radiolucency less than 1 centimeter. In periapical cyst, the pain may be absent or there is tenderness on biting hard food, same like periapical granuloma. It might be tender on percussion or non-tender on percussion. Expansion of cortical plate of the bone might be seen here because it is a cyst. And the major difference between periapical granuloma and periapical cyst is seen in the radiographic feature, which says that there is well-defined periapical radiolucency more than 1 centimeter. So that's the major difference here. So one important thing to keep in mind is the patient may say that he or she took the medication and there is no pain. So that is also considered as tender on percussion. Because of the medication, the pain is suppressed. So I hope you got something out of it. Do like, share, and subscribe for more.